Hi, everyone. Welcome to yet another episode here at Bajeti Hub. My name is Irene Nuva, and today I'm joined on set with two amazing ladies who we will be discussing with mental health financing. So, before we proceed, I'd just love them to introduce themselves, tell us who they are and where they come from. So, we'll start with my colleague at the far end.
Thanks, Irene. My name is Nema Wangoi, and I am part of the team at Bajeti Hub. I support our capacity building and learning work. Yes.
Thanks, Neema. Mm-hmm.
Um, I'm Jemima Mudhoni. I support programs implementation at Health Rights Advocacy Forum, HERAF. I'm also in mental health and public finance advocacy.
Thanks, Jemima and Neema, for joining us today. And we are here to discuss a very interesting topic. I know we recently celebrated the Mental Health Awareness Month, but as we always say, we are never late to the conversation. And today we are here to discuss mental health financing. And I know both of you are really passionate about mental health. Maybe let's start with Neema. Why are you passionate about mental health?
Yeah, I think for me, the very beginning of it was experiencing mental health challenges at a personal level, predominantly in my high school life. But back then, I didn't really know what this was about. It's just knowing you're facing something but can't really explain it. And later on into university, getting into the mental health club and writing some articles for them, because then I realized an outlet for me was writing down what I was feeling and trying to express it and having other people read about it and hear from their own experiences. Then once I got into Bajeti Hub and the PFM space, then being exposed to what advocacy means and finally getting my voice. And I think that's where I really got to get into the practical steps of my passion in mental health. Yeah.
Thanks, Neema. So I'd really love us to be very explicit because I know even in mental health, it's one of those areas where it's very gray. So people will tell you I'm experiencing mental health issues, but they will not say what they are experiencing. So maybe Jemima, even as you tell us why you're passionate about mental health, you can just give us examples of things that you've seen people experience, which are termed as mental health cases.
Um, Thank you, Irene. I think for me, I want to say mental health conversation found me. And when it found me, it was by virtue of implementing a mental health project. Back in 2018, we started advocacy around mental health policy. And then we got deeper in 2021 into implementation of community level projects for mental health.
Mhm.
I think by my default setting is I love safeguarding for vulnerable populations. And all along, I thought of vulnerable populations as children, young girls, the elderly, and I stopped there. And then I had a project that exposed me to persons with lived experience of mental health conditions. And one of the things you'd observe is a lot of them were not able to be gainfully engaged in the normal life concerns.
Mm,
Like in a farming community, you have a farm, you can't farm, you have children, you can't take care of them.
mm,
So this person is detached. And then getting to understand why, if this person is already diagnosed, why they are all over the chart,
mm,
and beginning to understand that part of the problem is shortage of mental health drugs
mm,
in the primary healthcare facilities. And that is how I think I got initiated into advocacy for mental health,
mhm,
mainly to protect rights of persons with a lived experience and for governments to do more that these persons are able to live gainful living.
mm,
So for most people, mental health conditions will look like inability to manage normal stresses in life.
mhm,
Um, and this can be triggered by anything. It can be triggered by loss of a job, loss of a loved one, and spirals out of control. So at the basic level, it comes down to managing stress.
Mm,
How well are you able to manage stress? Do people have those livelihood skills to be able to do that?
mm,
Issues around self-esteem, issues around bullying, all
mm,
these are the things that can trigger one to experience a mental health conditions.
mm,
And of course, then there is a big array of mental health diagnosis where we have the psychiatric conditions,
mhm,
diagnosis of, for example, depression, schizophrenia, bipolar, the eating disorders, the
mm,
behavioral disorders in children, all this.
mm.
Yes.
Thanks a lot, Jamim. I think you've taken us a deep dive into just understanding some of
Yeah.
the mental health conditions.
Mm.
And I know today we'll be tackling the PFM side of things
Yeah.
because, as you mentioned, there's a gap when you look at how mental health is financed.
Mm.
And I think at this point I'll actually bring you on board, Neema, because you did a very interesting paper on mental health financing,
Mm.
which was titled "Check on a Bro." And basically, it highlighted that side where we are advocating for Mental Health Awareness Month, but a key section of it was just trying to like give some of the findings in regards to mental health financing, and even just try to like see some of the best practices that we can find even outside Kenya, globally, in
Mm.
terms of how mental health financing has actually been done in practice. So maybe why was this an interesting thing for you? Because I know even for us at Bajeti Hub, it's one of a kind. So even when you talk about mental health, I think it's one where we are all getting oriented as at it, even as we discuss financing for it. So why was it something of interest to you?
Yeah, thanks. I think for me, once I got into the space and being exposed to public finance management, it was really a point of curiosity because I don't think before I got into the space, I ever thought of mental health as something the government gets involved in. Most of the time when you think about mental health care, you think about non-state actors. So
Mm,
you think private hospitals, and most of the times the perception when you think of mental health and government as a perception, there's not a very good image. Most of the time when you think of government and mental health, you think of Madare Hospital, and there's a lot of stigma surrounding it. So getting into the space and realizing that the government has a big role to play when it comes to ensuring that every citizen is accessing proper healthcare. And mental health care is actually part of that, especially the fact that it is backed on the constitution as a right. So that was the first point, curiosity. Number two, I would say that I found a gap because being curious in the space of what is going on in mental health, especially in PFM, I went on the internet, just browsing what is the kind of researches that have been done, whether it's articles or journals, and I realized there's a gap. So a majority of what is there is mostly on the health itself, the health side of it, and very little on maybe the financing. So most of it is just a mention of maybe the overall financing, but there's not really a
mm,
deep dive on budget documents and how the government is going around financing it. So I
mhm,
would say seeing that gap, I was like, okay, this is an opportunity for me to kind of bring this into this space.
mhm,
And I wouldn't go without mentioning that the Budgeti Hub team really pushing me and encouraging me to get into that
mm.
research. Yeah.
Thanks. I'd actually say that you're our mental health advocate in the office. And we are really glad that you're actually pushing us beyond how we even perceive mental health, even at the workspace. But Jamima, based on even what Neema is saying and even what you mentioned earlier, I think even for mental health, when you see how it is perceived and even viewed, it's just seen as this silent pandemic. So little is mentioned, well, we know a lot is going on at the back scenes. So why would you say this has remained the case, especially now with your experience having to work with communities and even just seeing how different mental health issues have just turned out?
Mm. I think part of that I would attribute it to social cultural barriers.
Mm-hmm,
Traditionally, across our African communities, there is how we define mental health, mental illness, and what we attribute it to. And a lot of the time, it's negative. So if I'm experiencing a crisis, I'm less likely to seek help because of the social cultural attachment to my
mm-hmm,
condition. So it becomes hidden in that way. I will hide until it gets to a point where now everybody can noticeably see there's something wrong with me.
Mhm.
But the period for early intervention, I will have missed that window.
Mhm.
So part of it is that social cultural barrier. And this also perpetuates the cycle of stigma.
Mhm.
So across communities, people have all these negative branding names for
Mhm.
persons with mental health conditions. And this stigma extends to their caregivers.
Mhm.
This stigma is also institutionalized because if I'm perceiving mental health conditions negatively, if I sit in policy and decision making spaces, then this translates into how I prioritize and invest, make decisions for prioritization and investment in
Mhm.
mental health. So a lot of it has to do with stigma, the barriers that exist,
Mhm.
and how this permeate into institutional and other systemic levels.
Just a quick follow up.
Mm,
When you mention stigma and some of the things on how mental health manifests, some
mm,
of these issues actually have a like a connection to the legal side of things.
yeah.
And I'd love to maybe if you can shed light,
Mm,
especially on the policy side of things. How
mm,
does that look? And
mm,
maybe what would it take for us to mainstream
mm,
mental health? Because I think that's where everything should
mm,
actually start when you think
yeah.
about
Yeah.
advocating for mental health.
Yeah. I think in Kenya we are doing rather well.
Hmm.
We have the Kenya Mental Health Policy from 2015 to 2030, and the implementation of this document began around 2017, 2018. Then later, around 2021, Ministry of Health developed the Kenya Coastal Mental Health Action Plan, and this was just an investment framework to give life to the policy.
Mhm.
And if you look at what they've done at national level after that, they've gone ahead to do a suicide prevention strategy.
Mhm.
They've gone ahead, we now have the amended mental health law of 2022. We now have the Kenya mental health investment case.
Mhm.
Uh, a lot of work has been done, a lot of inroads at policy level.
Mhm.
And I would say that is remarkably good political goodwill. The
Mhm.
gap now remains in dissemination
Mhm.
because at national health is a devolved function. So
Mhm.
even as Ministry of Health puts all these strategies in place, there is limited dissemination and
Mhm.
support to counties to implement.
Ah, ah.
So that's the biggest gap.
Mhm.
Again, you'll find through public-private partnerships, some
Mhm.
counties have gone ahead and developed county-specific investment strategies.
Mhm.
For example, Nyeri, Kajiado, these are some of the Kilifi, some of the counties that have come up with an investment framework.
Mhm.
Now, the gap goes further now. You have
Mhm.
a framework in place on paper, it looks very good.
Mhm.
But if there are no mental health specific funds aligned to implementing that strategic plan,
Mhm.
it sits on a shelf somewhere
True.
collecting dust.
Yeah.
So I would say policy wise, we are doing very well.
Mhm.
The biggest hurdle is implementation. And this implementation is greatly hindered by are we putting money
Mhm.
to back implementation of these policies?
Mhm.
Yeah.
Thanks. Maybe just you could help us understand when you say the costing, how
Mm.
does that look like, and maybe how has that been adopted in counties? Because you
Yeah.
mentioned it's at the national level.
Yeah. So at national level, the national government, in this case, the Ministry of Health, will put in place largely a broad strategy.
Mhm.
Then counties are able to customize that for their use. So, for
Mhm.
example, at national level, the costed action plan will look like interpreting strategic focus areas for
Mhm.
leadership and governance. One of the biggest gaps we have across board is strong leadership for mental health and governance.
Mhm.
So, putting in place that at county level, that would look like establishing a mental health council,
Mhm.
mental health systems strengthening, and this includes how, for example, counties use ICT, their health information systems, and capacity training generally for people to be better able to uh, access quality mental health services. a big component of it, human resource. So what would happen is the broader guiding framework is in place.
Mhm.
So counties will sit and see what applies for us. Or if we interpret leadership and governance, what does that mean for our county?
Mhm.
So counties may choose to prioritize having a mental health council in place.
Mhm.
Others may decide we need a multidisciplinary team in place to steer this. It may be a technical working group that can steer conversations around coordination, leadership, and governance for mental health. It may look like, can we have a mental health focal person seated at the county health management team? Can we devolve this position to the sub-counties, to facilities, to community level? So
Mhm.
counties interpret what that looks like. But for this to be implemented, it has to be costed.
Yeah.
So the costing is for example, there's a recommendation in law that we establish a mental health council. So
Mhm.
what does this mean? At county level, that will mean we need a county law to
Mhm.
anchor the mental health council. This council will attract funding. So we also need a fund and regulations on how to
Mhm.
implement that. So sitting with a technical team and costing all that and putting it in one document, kind of how governments do budgets. You know the program areas where you want to invest, then you come back and say this program caters to this. This is
Mhm.
will be the actual cost. So that now with this, a sector can say we have allocated this much to implement this strategic area in this policy. And then for us in public finance management, you can come back and track, for example, what is the implementation status of the National Mental Health Action Plan.
Mhm.
And then you'll be able to see, well, they put money in training,
Mhm.
or a partner put money in training. These the through public-private partnerships, these are options. And they've been able to train over target 100,000 healthcare workers. Over this period, they've been able to train half that number. So that is the essence of costing it. So
Mhm.
you know what needs to be done,
Mhm.
what costs is attributed to that,
Yeah.
and then coming back to seeing how governments are fulfilling their commitment
Mhm.
to implementation of these strategies.
Yeah.
Yeah.
So you've actually taken us to a good place because I know a very big of the research piece that NEMA did
Yeah.
actually took like a delve just to understand the numbers when you think about mental health financing as a total allocation of even how the health
Yes.
sector is financed.
Mm.
So maybe NEMA, as we look at the numbers, how does that look like?
Yeah, thanks, Jemima and Irene. And I think that's a good way to go about it. And I like how Jemima has showed us how this has to be costed,
Mm-hmm.
especially at the county level. And I think that is one of the things the research really explores
Mm-hmm.
and the gaps that we see, especially at the county level. So, as you said, health is devolved. It's one of those functions that's really been devolved to the county level. And
Mm-hmm.
looking at how these allocations are being done at the county level, there's a really huge gap. So something really interesting that caught my attention, especially when I look at PFM and mental health, is the first thing I ever did was just browse how much is the Kenya government allocating to mental health. The first thing you see is 0.01% of its budget,
Mm-hmm.
or 15 cents per capita.
Yeah.
That number really strikes you.
Mm-hmm.
If you think about 15 cents today, I don't even think you can find a 15-cent coin. To think about that, a 15-cent coin, even if you find it, can't get you a candy, a particle,
Mm-hmm.
really gets you wondering that the government is allocating that per person. As a taxpayer, that's what the government is allocating for you when it comes to mental health. It really gets you thinking. So then the research takes a deep dive into budget documents and looking at some of these allocations at the national level. So we have allocations at national and we have allocations at county. So at the national level, as Jemima is mentioning, there are really, really good policies, very comprehensive. They have a really good approach on how they will go about things. But when you get, it's the bus without the fuel, because there's very little fuel for us to get this bus moving.
Mm-hmm.
When you get into the budget documents, there's not much hope when it comes to allocation. Well, if you look at it at the national level, the paper explores Madari Hospital allocation. That is a line at the national level, budget documents. And something really interesting that strikes you once you get into this paper is the allocations to develop to recurrent expenditure at Madari Hospital are really reducing.
Mm-hmm.
And actually I got a number that when it comes to development expenditure between 2022 and 2023 2024, there was a 500 million cut in development expenditure. That's a
Mhm.
huge chunk. And to consider, even with the supplementary, this was not changed.
Mhm.
It shows that there's not really people taking interest in the allocation that is happening in mental health.
Mhm.
Then, when you look at the recurrent that is responsible for medication, as she's mentioning, for nurses, paying the nurses, the staff, the electricity, water. And when you go to something like Mathare Hospital, you hear a lot about this dilapidation of, the infrastructure that is there, the way the people are living there. They're not very good conditions for people that are already suffering mental health conditions.
Mhm.
So we are seeing their locations when it comes to the national level, they're not very encouraging, despite the fact that the policies are really good and they're there.
Mhm.
Then at the county level where this is devolved, the research tries to take a sample of some counties and get into their budget documents to see how mental health is being either mentioned, if there are any lines on mental health,
Mhm.
and there's literally little to nothing about mental health in most
Mhm.
of these counties.
Mhm.
In some, you can see that there's some effort to allocate to mental health under some departments. You can see some non financial information in some, like indicators on mental health. But in
Mhm.
some counties, there's no mention at all. If you do the command find and search mental health, there's no match whatsoever. And that
Mhm.
really strikes you because at the point where a majority of health facilities are supposed to be offering mental health care at the county level,
Mhm.
and budget documents are not backing this allocation, even
Mhm.
if we have the policies, we have the costed plans looking good, if we are
Mhm.
not allocating for it, then there's really nothing much that we can do. And
Mhm.
finally, as I close, one would wonder, okay, if mental health is not receiving an allocation, does this mean as a whole, the health sector, maybe the health sector is not receiving funding in general? But
Mhm.
this is not the case because when you look at the health sector, over the years, it is receiving an increase in funding
Mhm.
around from around 2022 2023
Mhm.
coming forward to 2025 2026, we're getting a 2 billion plus increase in
Mhm.
every financial year when it comes to the health sector in general.
Mhm.
So it's not a reflection that the health sector is not receiving funding, it's
Mhm.
a reflection that we're not keen when it comes to mental health funding. Yeah.
Nema, I'd really love us to push the ball because even when we are here today, we are also trying to see how even maybe people who are there at home, how they can also like champion for some of these issues, even as they attend public participation forums, even as they engage with the different budget decisions.
Yeah.
Where would you say the gap is at? Because we know, even as we blame the gap at implementation, it could be as a result of many issues, as a gap of things that happen during the budget formulation stage. Maybe it's that people didn't prioritize mental health and such. So where would you say people are dropping the ball? So is it that it's not happening at formulation, and as we say, if it's not budgeted for,
Yeah.
it will not happen?
Yeah.
So where do you say like the actual gap is?
Yeah, I think that's an interesting way to look at it. And I think for me, first, the stigma, the fact that the conversations even at the community level are not taking place, is where we really need to emphasize on,
Mm,
because once we get the conversations moving at the county level,
mm,
then even from sector hearings, we have people in the room who are advocating for it from that point.
mm,
Because as you said, if it is not in the formulation stage, then we cannot complain that it is not in the implementation, because if it wasn't there when we were formulating the budget, then it's not going to be there when it's being
mm,
implemented. If we have people in the room in sector hearings, in budget policy statements at the national, in county fiscal strategy papers at the county,
mm,
people in the room already telling counties we need to prioritize this, to documents even such as the CIDPs that are happening and giving a
mm,
strategy of up to 5 years.
mm,
Once we are in the room when these documents are being made and we are stating them as priorities for the county, then
mm,
once they're in such budget documents, once we get to the annual development plans on what we are doing for that year, we already have it in the 5 year plan.
mm,
So we're going to say, okay, this was already a priority for us. So then that is the reason why we need to prioritize it even
mm,
for this upcoming financial year. So I
mm,
definitely think that as citizens, we need to be in these discussions from the very beginning,
mm,
especially in the budget process,
mm.
for sure.
So coming to you, Jemima, I know Neema has really given us how the figures look like, even when you look at the national budget.
Yeah.
And I'm sure even when you go to the counties, the case is no different. But I'd really love if you can paint how the picture looks like now at the point of service delivery with
Mhm.
the low allocations that are there to mental health financing.
Mhm. Um, Maybe I'll begin by adding to what Neema is speaking to.
Mm-hmm.
And part of the problem, or where we drop the ball, is lack of mental health data. We don't have
Mm-hmm.
evidence
Mm,
to inform decision making.
mm,
So you realize in Kenya we still use broad global statistics to
mm,
gauge prevalence of mental health conditions in the country.
mm,
We still say 25% of persons accessing outpatient services
mm,
likely to have a mental health condition,
mm,
40% for inpatient facilities. These are global statistics.
mm,
In this country, a lot of data is there because it's there in the outpatient registers, but it's not mined. There's no supporting mental health indicators at Ministry of Health level
mm,
to help us get to understand these are problem for whom, to what
mm,
extent. And then we sit back and say, we have this data, then can we start thinking of the right intervention to make?
mm,
And you realize for various communities, various counties, that intervention will look like the people served by these sectors.
mm,
So at community level, the impact of low mental health financing looks like what I see when I walk around in my village. I see a lot of people who are relapsing. So a person got to a facility, got a diagnosis, but they're not able to stay well, like maintain their wellness even while on treatment. And when you look at why is this happening, one of the reasons one will be the erratic supply and
mm,
availability of mental health drugs.
mm,
The other bit will be around issues of clinical review.
mm,
For persons with other NCDs like hypertension, diabetes,
mm,
there are monthly review clinics.
mm,
Uh, and for persons with these conditions, you'd understand a person is mentally well enough to realize
mm,
I'm due for a review
mm,
and
mm,
plan for that and actualize it.
mm,
For the person with lived mental health experience, a caregiver may be making these decisions.
mm,
Now, one of the things you realize at community level is that most persons with mental health conditions tend to be at the bottom of the poorest in these communities.
mm,
Because even when you are skilled, it's hard for you to hold down a job.
mm,
uh, Even when you're in a farming community, it's hard for you to sustain your wellness, for you to be gainfully engaged.
mm,
So the caregiver now has a double burden: take care of themselves and take care of the person with the lived experience. And
mm,
this may be an adult, so an
mm,
adult should be helping to carry their load.
mm,
So there's a lot of caregiver fatigue, because when the National Health Insurance Scheme has the challenges we are seeing
mm,
highlighted in the media.
mm,
When our people are struggling to put food on the table,
mm,
so health tends to take a back seat.
mm,
Now, for this person, they need that tablet or a mix of tablets, that treatment on a daily basis to sustain their wellness.
mm,
So, if this person is a casual laborer, if I get 200 shillings a day on a good day,
mm,
now I'm torn between competing priorities. Do I put
mm,
food on the table?
mm,
Do I buy drugs? Do I? So it's a sad situation.
mm,
So there'll be a lot of relapses for persons with mental health conditions, and this, by extension, is increasing poverty and dependence amongst persons with mental health
mm,
conditions. The other bit is around investment for human resource for mental health. Um, you'll find nationally, I saw this early this month, the Kenya Psychiatric Association held their conference.
mm,
And one of the things that came out from the president was that we have 150 psychiatrists
mm,
nationally serving like 50 million of us.
mm,
So the shortage of human resource The other bit is around investments for infrastructure, um, ICT, as an example of telemedicine. You'll find counties are still allocating, and I take an example of my home county, Nyeri County. Nyeri County has around 131 public health facilities. We are not really a big county in terms of land mass and population. So if going forward, my county is allocating money into construction of a health facility, you look at it like a misplaced priority because the focus should be on telemedicine.
Yeah.
If we have 150 psychiatrists, my county does very well. It has 3 of those 150. But we would want other counties to, for example, tap into telemedicine and be able to access the psychiatrist seated at the National Mental Health Referral Hospital without actually making that dependent person incur an additional cost of coming to Madari to access the same services. So this is part of what we are seeing when there is shortage in financing for mental health.
Thanks. I know we've mentioned quite a number of challenges when it comes to mental health financing,
Mm.
from the low allocations, from the data, from even things like the caregiver fatigue and everything. But it would be really a lot of disservice today if we don't get to discuss the solutions and even some of the recommendations that we are making. So maybe Neema, you can start us off with some of the recommendations, if there are any global practices of where mental health has actually been financed in practice. So, like, how do we go from here?
Mm.
We've accepted that there is a challenge. So, how do we proceed from here?
Yeah. I think I would reference this to the mental health investment case that is already available for us. And they've done a really extensive step by step on how we can go about it.
Mm-hmm.
Something really interesting that I explore in the research is they give a breakdown of why invest in mental health. And they really show you that an investment in mental health has a huge benefit on the country economically. So they do mention that as of 2021, we had an economic burden of around 60 billion on selected mental health disorders as an economic burden. And they give that as, when you compare, we at that same year, we were only, the expenditure was 5.5 billion. Of this, the government is only expending around 2.5. That is an extremely small percentage compared to the burden that is there. They go ahead to show us that for some of these mental health disorders, for example, in depression, they show you that for every 1 shilling you invest, when you move that 15 cents to 1 shilling, you get a return of up to 4 shillings or thereabout for every that 1 shilling that you increase in your budget. And I think it's really interesting for us to know that when we speak about investing in mental health, it's not just investing for the sake. It's the people that are living with these experiences having a better life. And even for us as a country economically, we are facing benefits directly to our economy and growing, both in productivity of the people, giving back to the economy and the economy growing, and also just people living in better living conditions as citizens of the country. And I think for a final recommendation I can give, something really interesting is on the health tax. So we impose health tax on some of these harmful products like alcoholic beverages and tobacco. Now, something interesting I found is the alcoholic um, market has a really huge tax benefit when it comes to how much tax they give back to the country. I think for as the year 2023, there was a report that they are giving up to 150 billion in health tax. Now, this health tax, a majority of the time, is actually just being taken to the consolidated funds of to the national treasury, and it's just distributed on, here and there, here and there. But something I would recommend is, how about we get more intentional in kind of ring fencing, sorry, some of these health taxes that we are giving, especially on these alcoholic and tobacco products that really catalyze mental health disorders. So we be intentional. So even if we take around 40% of this 150 billion, it's already around 60 billion. That is already covering the economic burden that we had in 2021. So thinking about this and being more intentional in channeling some of these funds, because as we know, there are a lot of competing priorities in the health sector. We're already dealing with, TB, malaria, and all that. So taking this health taxes on tobacco and alcohol, and specifically channeling them to mental health can really go a long way
Mm.
in some of these financing gaps that we have in mental health.
Thanks, Neema. Over to you, Jemima. So maybe you can give us some of the few recommendations adding to what Neema has said, but you
Mm.
can also add. I know even in Nyeri, you do a lot of mental health research and advocacy, and you've even gone like a step further where you've done a costed work plan for Nyeri County. So you can also share with us because I know even for people who are out there, some might be interested to replicate this in their county. So what are some of the lessons, the challenges, the experiences that you've had, even with the county, in terms of just how the costing and even in the intake of the costed work plan in general?
Mm. Uh, Thank you, Irene. Thank you, Neema. Um, to our partners, citizens, other viewers,
Mhm,
I think counties still need a lot of support
mhm,
for them to implement the the progressive strategic policies at national level. And part of that is customizing what is necessary for counties. I saw Nairobi
mhm,
County launch their action plan this year.
mhm,
So progressively, this is happening. I don't think we are still at, I'm not sure tumefika 10% of
mhm,
counties that have costed mental health action plans. But
Mm,
for anyone willing to work in partnership with county governments to actualize this, there is a national framework, the
mhm,
Kenya National Mental Health Strategic Action Plan.
mhm,
Unfortunately, it's dated 2021 to 2025. It would also be interesting to see the implementation status at national level of that action plan.
mhm,
So there is a guiding framework at national level. So the task is to sit with counties in a multi-stakeholder forum. For example, in Nyeri, we had the benefit of having caregivers, persons with the lived experience of mental health conditions, technical officers from the County Department of Health, and other CSO actors
mhm,
sit together over a period of about 7 days and craft uh, what interpretation of that national action plan looks like for Nyeri. And having done this, and we got a lot of support from the M&E department that came back and put indicators for tracking implementation, costing, and all the beautiful things that went into this action plan. Now, where our we started hitting a bit of snags is we don't have a county mental health specific budget line. So
mhm,
that you'd say in year one, the county put 1 million towards
mhm,
implementation of this strategy. We want this increased to by this percentage in year
mhm,
two. We
mhm,
can't track that. That doesn't mean that Nyeri County is not doing something around mental health. Of course, service delivery is still ongoing. But for us to strengthen the health system for service delivery, there is that whole roadmap that lack of funding has hindered its implementation. So that's largely one. The other bit is since we developed that cost reduction plan, the county has gone ahead to develop other strategies. For example, they have a strategy for community health services that has implication on access to services because community health services is access to services at household level. Um, they, they, they acknowledge mental health as a problem and doesn't really get much further than that.
mhm,
Then they have a primary care network strategy that looks at prioritizing awareness and enriches. So it's advancing something in the costed mental health action plan. Then we have there's another strategy that they have out.
mhm,
And if you look at across around 4 strategies, and then you start aligning them to the PFM cycle.
mhm,
So you have all these beautiful strategies in health, including the county health strategic plan. And you start to look at, they have these beautiful visions uh, s- at various level of comprehensiveness. How do they feed it annual development plan, how do they feed into the county budget?
Mm.
Because if they're not feeding into these documents,
Mm.
then nobody is being deliberate about implementing these strategies.
Mm.
And you find Nyeri County, when they did the CIDP 3, they were very intentional. They included an indicator for screening for mental health conditions at community health units. But this indicator never carried to any ADP.
Mm.
Then when you look at the implementation reports and you want to understand this NCD program, sub-program, what is it doing where? You realize a lot of the deliverables will look like screening for hypertension, screening for diabetes, screening for cancer.
Mm.
So at some point you ask yourself, should we rename this sub-program to NCD and mental health so that there's a more deliberate effort to put resources into mental health? So this is part of the challenges we see. So there is that fragmentation, and then even when it's very nice to have a clearly thought out strategy, how does it get harmonized into county planning and budgeting documents? And for us, it's interesting because we want to track. The only way you can track this goodwill in this document is in the budget and what this budget was actually spent on when they come back and report on it. So if you're not seeing this, that's a big challenge. The other bit is the stigma component. Who is advocating for the issues for persons with mental health conditions? Is it the overwhelmed caregiver? Is it the person with lived experience? Is it us in the civil society? There's low advocacy for this. And what happens normally when people go to public participation, they will prioritize infrastructure like concrete, the brick and mortar.
Yeah.
So people will keep on asking for marams, for roads, they will ask for water, they'll ask for all these things. Nobody remembers to ask for anything for health sector. And when they do an ask, it's interpreted as we need to build another dispensary, we need to build another health center.
Yeah.
Now, with that small ask, there's even a smaller ask for mental health because in the decision making spaces, the person with lived experience, that caregiver, is not included. That exclusion may not be deliberate. It may look like a county holding one county forum, uh, expecting this person to leave their daily hustle, look for money, attend the forum, and make a submission. And we all know what happens. We get into rooms, we suggest things. At times, we are just they feel like echo chambers. Nothing comes out of it. So these are part of the challenges we are seeing. So our learning from that, one, we need ring fencing for mental health resources. A lot of these beautiful things will not happen if we don't ring fence resources because all these other competing interests get to go to places where there are louder voices. Then we also need citizens to advocate because it's the same example for advocacy for children. I'm not saying that I'm not equating persons with mental health conditions to children, but we understand that maintaining, especially with erratic management of a condition, maintaining advocacy, survivor-led advocacy for your issue may be a bit tricky. And the cycle doesn't wait for you. Plans will still be made, budgets will be spent, your issue is not addressed. So it's up to us to take up advocacy for these issues. Again, for governments, it's not enough to ring fence resources, put in place mechanisms to track expenditure on mental health. We have a big challenge still in data. The Ministry of Health piloted around 18 clinical indicators to try and bridge that gap. I'm not sure whether they've been rolled out nationally, but if they've not, it's about time they do that. Additionally, having an M&E framework in place so that who is the custodian, who is charged with collating this data and what decisions does it inform at county level towards improving access to mental health services. Thank you.
Thanks, Jemima. So as we close,
Yeah.
Neema and Jemima, what would you say is your biggest hope when you think about mental health financing in future? We'll start with Jemima in less than a minute, then go to Neema.
I look forward to a place where this country has a known and sustainable financing mechanism for health largely and for mental health, so that we are all able to access quality mental health
Mhm.
services at the point of need, so that we don't lose another young person to suicide. It
Mm,
could have been prevented with early screening. We don't lose a postnatal mother
mhm,
to postpartum depression, because these are the daily losses we
mm,
experience
mm,
when we are underinvesting in mental health. So I
mhm.
look forward to that day.
Thanks, Jemima.
Thank you.
Neoma.
I think mine is simple that the growing recognition for mental health really continues
Mm-hmm.
beyond policy level to community level, and
Yeah.
that people understand that mental health care is not something to be ashamed of, it's not
Mm.
something to hide and shy away from, and it is not a luxury. No, most people, Gen Z my age, we really like, it's not good for my mental health, I quit that job because it's not good for my mental health. And most people might look at that like, these kids, they think mental health is just a luxury, but
Mm.
really to recognize that mental health is really important. It's for everyone, and it's something that is a fundamental right according to the Constitution.
Thanks, Neema. So I'll just pick it up from where you've stopped. And I know for for most people, they actually we live in a woke generation, and you'll hear people saying that we are in the fight towards mental health. So I think our push today is that we can actually move that conversation into the budget side of things where we'll
Mm,
actually get mental health financed.
mm,
So with that said, thanks a lot, ladies, for joining us today for this episode. But you can be sure to catch other episodes in our YouTube channel at Budgeti Hub. And you can also check out our social media platforms just to continue with the conversations around budgets and how they work for the common mwananchi. Bye bye.